Warm greetings from the High 10. It is Everyday Shenanigans on this Tuesday, June 30th, 2020. I'd like to bring you some information on a new virus that has hit the globe, and prayers to all affected, and prayers for this country and those abroad. Yes, once again, we have a new virus on the horizon. If you need verification for the storyline, please log on to CNBC. Dr. Anthony Fauci says new virus in China has trace of 2009 swine flu and 1918 pandemic flu. Key points. White House coronavirus advisor Dr. Anthony Fauci says U.S. health officials are keeping an eye on a new strain of flu carried by pigs in China that has characteristics of the 2009 H1N1 virus and 1918 pandemic flu. The virus, which scientists are calling G4EA H1N1, has not yet been shown to infect humans, but it is exhibiting reassortment capabilities. Fauci told the Senate Health, Education, Labor and Pensions Committee during a hearing Tuesday. The H1N1 swine flu emerged in Mexico in April 2009, infecting 60.8 million people in the U.S. and at least 700 million worldwide. An estimated 151,700 to 575,400 people died from the virus across the globe, according to the CDC. White House coronavirus advisor Dr. Anthony Fauci said Tuesday that U.S. health officials are keeping an eye on a new strain of flu carried by pigs in China that has characteristics of the 2009 H1N1 virus and 1918 pandemic flu. The virus, which scientists are calling G4EA H1N1, has not yet been shown to infect humans, but it is exhibiting reassortment capabilities, Fauci, director of the National Institute of Allergy and Infectious Diseases, told the Senate Health, Education, Labor and Pensions Committee during a hearing. In other words, when you get a brand new virus, it turns out to be a pandemic virus is either due to mutations and or the reassortment or exchanges of genes, he told lawmakers. And they're seeing virus in swine, in pigs now that have characteristics of the 2009 H1N1, of the original 1918, which many of our flu viruses have remnants of that in it, as well as segments from other hosts like swine. The H1N1 swine flu and 1918 pandemic flu were both considered horrific viruses that spread across the globe. The H1N1 swine flu emerged in Mexico in April 2009, infecting 60.8 million people in the United States alone and at least 700 million worldwide. An estimated 151,700 to 575,400 people died from the virus across the globe, according to the Centers for Disease Control and Prevention. It is now seen as one of a variety of seasonal flu viruses. The 1918 flu, which Fauci has often compared to COVID-19, is estimated to have killed between 30 million and 50 million people, according to the CDC. More than 20 million people died in World War I by comparison. The new strain that is spreading in pig farms in China has been identified as having all the essential hallmarks of a candidate pandemic virus, scientists say. Fauci said Tuesday, there's always a possibility that you might have another swine flu type outbreak, as we had in 2009. It's something that still is in the stage of examination, he said. It's not an immediate threat where you're seeing infections, but it's something we need to keep our eye on, just the way we did in 2009 with the emergence of the swine flu. Fauci's comments came as the coronavirus continues to rapidly spread across the U.S., with the 7-day average of the new cases growing by 5% or more in at least 40 states, including Arizona, Texas, Florida, and Oklahoma, according to a CNBC analysis of data compiled by Johns Hopkins University. Public health officials and physicians have criticized the Trump administration's lack of coordinated response to the virus. In recent weeks, President Donald Trump has downplayed the virus, saying the U.S. is nearing the end of the pandemic, contrary to experts in his own administration. Earlier this month, Fauci said COVID-19 turned out to be his worst nightmare come to life as the coronavirus continues to rapidly spread across the globe. He said the virus is very different from other outbreaks such as Ebola and HIV. The virus jumped from an animal host and has a high degree of transmissibility, and mortality, he said. It is historically one of the worst pandemics the world has ever experienced, he said, adding people have compared it to the 1918 flu. First detected in Wuhan, China about 6 months ago, the new coronavirus has already infected more than 10.4 million people across the globe, killing more than 500,000. On Tuesday, Fauci told lawmakers that he is concerned about the rise in new cases in places such as Texas and Florida. He said reopening schools in the fall season will depend on the dynamics of the outbreak and the particular location of the school in question. And that is the said information pertaining to the swine flu that has emerged in China. If you need verification for the storyline, please log on to CNBC. Well, what I would like to know is, where did they see the swine flu? Did you see it in a human? What? That's what I'm curious to know, because it doesn't give much detail about, it just says it's a new strain of flu carried by pigs. And that's basically it. It doesn't really say. And they're just basically saying they're seeing the virus in swine in pigs now. And it has the characteristics of the 2009 H1N1 of the original 1918 virus flu that killed many people. So, I don't know, but it's daunting enough with the COVID-19 and now this swine flu. And I don't know what it's the flying criteria is as far as people traveling out of the U.S. at the moment and people traveling into the U.S. and other said countries. I guess I need to do research on that to see what the flight plans are currently as far as flying in and out of the U.S., because that will be the key to Americans contracting the swine flu if and so it jumps off and becomes a pandemic in China. Then we know if people are allowed to venture out of China into other countries, then we will be affected by this swine flu. It's never ending. But I thought I'd bring you all that said information. In my mind, I was saying to myself today, did we need to keep the country closed till the end of the year? You understand what I'm saying? Because taking a chance to open the country was dire. People not having work, people not being able to patronize businesses, functions, leisure activities. But then what you have to say to yourself, what's the catch-all in reopening the country? Stores, what is the price? And as you see, COVID-19 has not left the states. There is an uptick in certain cities. It never left. It wasn't going to leave. We do not have a vaccination. Some of you are on board with getting it. Some of you are not. But what I tell myself is, I take medicine for so many different things over the years. What would be the difference in me taking the vaccination? I don't believe in a lot of crazy hypotheses and conspiracy theories on the vaccination because I don't have that kind of time. Because if that's the case, I would have never taken any of the medicine that I had to take in order to sustain life, such as high blood pressure medicine, antibiotics, on and on. You've got to trust someone sometimes. We live in a world, especially in this country, where people are very combative, and America couldn't keep people in their houses during the pandemic. The government couldn't keep you. They didn't keep it mandated to keep you in your homes, to venture about with or without a mask. So I don't see them forcing you to take a vaccination. I just don't. Because we didn't have control over people venturing out into the street when they told us to stay in mid-March. So some people are worrying about the government tracking them and I don't barter or argue with that type of foolishness, because I know, as I state, we have combative people in this country, and they're not going to adhere to staying in, nor are they going to take a vaccine if they don't want to, even if it's mandated by the government. And how can the government force you to take the vaccination? That would be up for conversation, perhaps. I don't know, but I don't see it happening, just because, as I state, they couldn't keep you inside in mid-March. So how would they force you to take a vaccination? I think it'll be your choice if you decide to take it or not, but I don't think it will be mandated or you'll be fined if you don't. Either way, hearing about the swine flu doesn't help what's already out there, which is COVID-19. This just makes people worry more. I think right now we're just in a limbo situation. You're just walking out on faith, if you even have that, and praying that you don't get it, whether you're wearing the gloves or not. Because as you see, some people have gotten it and were in good health. Some people got it and said they were inside and didn't venture out. One lady got it just from reaching outside her door to pick up a UPS package or something like that. So you believe what you want to believe. But this is a sad situation. I'm praying that this swine flu does not get a jump off, because if that's the case, worrying about getting a vaccination for COVID-19 will be one thing, but then what will we do to combat the swine flu if there's an uptick in people catching it? Then you will need a vaccination for that. God bless all of you. Stay safe. Mask up, glove up if need be, if you feel the need to. Prayers for all. Thanks for joining me. Like, share, subscribe, drop your comments below. And this is Everyday Shenanigans. Good night.